will I be in pain after surgery? The short answer is yes. There's no way to make surgery painless, but we do everything we can to take the edge off to make it as comfortable as possible. One thing we do to help with that is called a nerve block. So at the time of surgery, your anesthesiologist will help us to perform a nerve block wherein numbing medication is inserted around the nerves to help give you feeling at the hip joint. This helps to decrease the deep pain that you would feel from the surgery if you had not had this block. Unfortunately, it cannot take away all the pain related to the surgery, but it can be very helpful. That nerve block will wear off, usually between 10 to 12 hours depending on the patient, after which time you may feel an increase of pain. We will send you home with a combination of prescription pain medicine to help conquer your pain from different angles. The goal is not to make you pain-free, which we can't really do, but it is to take the edge off until your body recovers naturally, after which time we will gradually end up recovering and going up the hill like we plan to according to our rehabilitation guideline. Well, that's going to depend a lot on what you do for work. So people who work mostly at the desk, use computers, or type a lot for work can frequently go back after 2 weeks. That allows enough time for you to get off the pain medicine and to feel a bit more comfortable sitting for prolonged periods. If your work requires driving, it typically takes 6 weeks to drive for work. Now you may be able to drive to work earlier depending on which side or hip we did, but if you're driving for work, typically that'll be 6 weeks. If your work requires heavy lifting, that typically takes longer. If you're heavy lifting all throughout the day, standing, running or walking, or using ladders, it may take as much as 3 months to get back to full duty. If there's an availability for partial duty at your workplace, I would look into that early on, before a surgery, so we can all be on the same page with your employer and ensure that you get what you need in terms of restrictions.